Awesome. All right. Well, it looks like those numbers are kind of settling in. So I think with that, we can get started with today's conversation, which is going to be a really great one. So, hello and welcome everybody to this episode of Connected Conversations. This one's called Bumping Out and Bouncing Back, addressing the complexity of weight stigma during pregnancy and postpartum. We're really excited for this conversation today, and it's going to build off of our last conversation. So let's meet who's with us today. So our guests today are doctors Tanya, I'm going to mess it up now, Dr. Tanya Nagpal, because I overthought it. Apologies, everybody. Dr. Angela Incollingo Rodriguez and Dr. Angela Alberga. So, with that, we're excited to tuck into this connected conversation. Over the course of our series, we've dug into a number of important topics related to obesity management, including discussions about all the different pillars of obesity management from our clinical practice guidelines. However, we've yet to really explore some of those important intersections of health-related obesity. We know that obesity is a chronic disease that impacts and is impacted by a number of other health conditions. In our last webinar, we got to discuss the science of obesity and pregnancy. And if you've not had a chance to see that one, fear not, you can still find the recording on our website. And I'll get Ian also to post a link in the chat so you can find that and catch up if you'd like to. But today we're really excited to build off of that discussion and tap into the issues of weight bias as it relates to pregnancy and postpartum. So for those of you that may have not joined a connected conversation before, these are our webinar series brought to you by Obesity Canada. And in these conversations, we dig into important topics for people living with obesity and connect with experts in the field. From advocating for access to evidence-based treatments, issues related to diet culture, weight bias, and discrimination, to innovating obesity care in Canada, these connected conversations really work to address the complexity of this chronic disease and the barriers for individuals living with obesity. I'm one of your hosts. My name is Lisa Schaefer. I'm a patient advocate and member of the patient community. And for the last 6 years, it's been my pleasure to volunteer and serve Obesity Canada, working on public engagement and advocacy for the millions of Canadians who, like me, live with this disease that is really highly stigmatized, misunderstood, and often misrepresented. With me as ever is my sidekick, Dr. Ian Patton, who is going to be here to help us through the webinar today. Ian, if you want to say hello and kind of just outline some of the housekeeping, that'd be great.
Hi, everyone. Happy to be here. Thanks for joining us. A couple quick housekeeping notes. You can interact with us using the chat feature. You can give questions or comments through there. You can also use the Q&A feature and type your questions in there. What I'll do is I'll make sure I monitor that, and we'll try and pull in as many of those questions and comments as we can throughout the discussion. If we don't happen to get to all of those questions right away, or by the end of this webinar, we can always approach those after the fact, so we can, we'll find a way to answer those questions. So don't worry about that. So please use the chat feature and the Q&A and let us know what you want to know about.
Awesome sauce. Well, let's move forward then, and let's introduce these amazing. Also, can I just say 3 ladies in STEM? I love. So thank you so much, everybody, for taking the time to join today. I'll introduce you a little more formally, and then we'll pass it over to you guys to talk a little bit as well. But Dr. Tanya Nagpal, I'm going to mess it up every time now, is an assistant professor at the University of Alberta with the Faculty of Kinesiology, Sports and Recreation. She completed her PhD from the University of Western Ontario with the Exercise and Pregnancy Lab and Exercise and Health Psychology Lab. Her dissertation work included developing and testing strategies to improve adherence to physical activity in pregnancy and in measuring downstream health outcomes for both mother and newborn. Following this, she completed a 2-year postdoctoral fellowship with the University Ottawa's Adamo Lab and Society of Obstetricians and Gynecologists of Canada. Her research aims to understand health-related stigma, such as obesity and weight stigma, from lived experience and implications on healthcare delivery and behaviors. We also have Dr. Angela Incollingo Rodriguez, who is an assistant professor of psychology and cognitive science at Worcester Polytechnic Institute in Massachusetts. Over the last several years, she has developed a program of research investigating weight stigma and its consequences in the context of pregnancy and maternal health, and has published over a dozen papers on this topic. As an international expert on pregnancy-related weight stigma, Angela collaborates with research teams around the world to understand and eliminate this damaging form of stigma. And finally, we have Dr. Angela Alberga, who is an associate professor of Tier 2 University Research Chair at Maternal, Child, and Youth Weight-Related Issues in the Department of Health, Kinesiology, and Applied Physiology at Concordia University in Montreal. She leads an interdisciplinary research program on weight-related issues, including obesity, weight stigma, eating disorders, body dissatisfaction, physical inactivity, and sedentary behavior. So these are very smart, very important ladies who have joined us here today. But let's be human. Let's dial it down a bit so Lisa doesn't have to use so many big words. And before we tuck in, why don't you guys introduce yourselves a little bit and tell us about the path that really brought you into working with obesity in this space as well? Maybe Tanya, why don't we start with you?
For sure. Hi, everyone. Really excited to be here. The path that really brought me to my research is actually through Obesity Canada. I'm going to call myself a lifer for Obesity Canada. I started out as a volunteer at my local university chapter when I was a master's student, and that was my first introduction to Obesity Canada. And I attended my very first summit meeting in Banff in, I think that was 2017.
Mhm.
And at that time, I had just sort of started my PhD work, and I was going to save the world with physical activity in pregnancy. And I remember attending my very first session at Obesity Canada, which was a lived experience presentation, and it completely changed my world. I saw for the first time, obesity from the lens of those with lived experience versus the papers that I was reading or what I was learning in lecture. And it changed my perspective on the research that I was doing, but also made me very interested in thinking about, well, how could I apply some of what I learned at the summit in pregnancy as well, which wasn't necessarily what was being spoken about at that time. And so after finishing my PhD work, I really wanted to dive deeper into weight stigma during pregnancy for my postdoc. And I had the opportunity to head over to the University of Ottawa and do a bit of exploratory work, interviewing women who had experience with obesity in pregnancy. And there was just no turning back from there. And it just continued. And I've had the opportunity to work with wonderful researchers like both the Angelas here in relation to weight stigma in pregnancy. But really, Lisa, my journey started through Obesity Canada.
Awesome. That was my first summit as well, was in Banff. So I love it. That's fantastic. Angela, I'm going to call you Angela IR for the moment. Why don't we move to you next? And you can tell us a little bit more about your path.
Sure. So I am just like beyond thrilled to be here, not only because I'm excited to talk about this topic to this group, but also because my co-panelists are two of my favorite people. So this is awesome. So if Tanya was going to save the world with exercise and pregnancy, I was going to save the world with dieting. So I started off as a dieting researcher, and I wanted to figure out why dieting is so difficult and how we promote successful dieting. But time and time again, I kept coming up against this barrier that dieting failure is the norm. It's very difficult to stick to a diet. We rarely see sustained weight loss from a diet. And when I started looking at the data, that even when we see a successful diet, the data rarely show that success at a diet translates into health. And so early in my training, I started to wonder, well, then, if dieting failure is the norm and successful dieting isn't even really a promoter of health, why is it that people are still so insistently pursuing dieting? And that's really what took me to confronting stigma, that it was weight stigma that's, really driving this behavior that might not even, oftentimes isn't even advantageous for health. And so then that led me into looking at all the different ways that weight stigma undermines biopsychosocial health. And then it was just being in the right place at the right time that I happened to notice that while the weight stigma literature was growing a lot, there wasn't really any research looking at weight stigma in the context of pregnancy. And so I decided to take that leap. And that's how I ended up in this space studying weight stigma in the context of pregnancy and maternal health. And now this field's really growing very quickly. So it's great to see that this area that, I wrote my first paper on the topic in 2016, and my conclusion was that there wasn't enough research on it. So it's amazing that now, not even 10 years later, there's enough that we can be having this conversation.
Oh, I love that. That's fantastic. All right, Angela, number 2. Why don't we move to you?
I'm so glad to be here. Thanks so much to the organizing committee, and I'm so glad to be able to speak with both of you too. This is just so fun to be co-panelists with all of you. I just want to also apologize for my voice. I don't usually sound like a dinosaur, but of course, this morning I woke up with Murphy's Law that I had to have symptoms of laryngitis for a live webinar. So here I am. Please bear with me throughout the session. If I have little coughing sprees, I'll mute myself. Just to introduce myself, I had a similar kind of background as Tanya, and even the other Angela too, because I am a behavioral medicine researcher by training. I'm a certified exercise physiologist by training. So I was really involved in sports. I loved playing different sports and coaching and training kids and teenagers. And then when it really came to doing research, I was actually inspired by a professor in my department who was doing research in relation to obesity in children. And she gave me my first research position. So she kind of believed in me and my thinking, loving working with children. And she gave me that position. And I just fell in love with the world of research. And then it's really only when I became more involved in research with children and teens, doing exercise interventions with them and try to improve mental health and physical health associated with their weight-related issues. Similar to Tanya's, when I had that experience of understanding their lived experience and having gone through weight-based teasing in schools and their family, hearing about it in healthcare and education, it really touched me. And I really think that that's kind of what changed a lot of my future career paths too, is those experiences. And also reading a lot of the work of Rebecca Pohl in the States, who everyone knows in the field of weight stigma. She really inspired me to learn more about this topic. And similarly to Tanya, I also sought out more research training in weight-related issues, more broadly than obesity, with a big focus on weight stigma. And it's from there that me too, I just continued in that route in the hopes that I would contribute more to this field, to better understand it, to contribute to advocacy and interventions to reduce weight bias and stigma, mostly in healthcare and educational settings. And here I am. Now I lead an interdisciplinary research program, mostly focused on improving health behaviors, but also addressing psychosocial health challenges living with weight-related issues, and with a big focus on reduction of weight stigma.
Amazing. I am so grateful that all three of you are in our ether as well, and that we get to bring this super group together today. I know I've had many friends that have gone through this experience of navigating pregnancy or wanting to conceive and bumping into obesity and stigma. I don't have lived experience myself, but I've definitely seen and felt through my friends a lot of this trauma almost that it can feel like. So let's tuck into some of that and remind ourselves. So the title of our webinar states addressing the complexity of weight stigma during pregnancy and postpartum. And I imagine it is really complex issue, but maybe let's start by explaining to the audience what we mean by weight stigma and how that impacts individuals with obesity in particular, and why this is an issue for this population that we're talking about today. So maybe Angela, let's go back to you and start there, since stigma is kind of in your world.
Sure. So yeah, terminology is quite important in understanding different terms and what they mean, especially in the context of pregnancy and postpartum. So just understand what weight bias is first. Weight bias is really those negative attitudes, those beliefs, those automatic assumptions, automatic negative thinking, beliefs that we think about people just purely based on their weight, just by looking at them, just by seeing people with higher weights. It's those negative feelings or attitudes we have about them. This could be anything from, there's so many examples of these, but I'll give you a couple in the context of pregnancy and postpartum. One is just disliking someone, thinking that they're unattractive or unintelligent just based on their weight, living in a larger body. In the pregnancy or postpartum context, it could really be things like assuming that someone's carrying twins because they live in a larger body, or assuming they're more further along in their pregnancy than they are just because they live in a larger body. Just thinking that someone's maybe also putting the baby at risk just by being pregnant, by being in a larger body. There's lots of these types of negative attitudes. These are just some examples of that. But then there's weight stigma, and weight stigma is when we start stereotyping people based on those negative attitudes. So if we start making assumptions about people just because they live in a larger body and they're going through pregnancy, things can be assumed like, well, they live in a larger body, they're pregnant, but clearly they don't exercise, or that they're not eating healthy, or they're not eating a healthful diet for the growth of their fetus just because they live in a larger body. So when we make those types of assumptions, that's when we think of it as weight stigma, those stereotypes that we assume based on people just because of their weight. You know, there's even some contexts where asking if someone is pregnant, even if they're not, that's even a stereotype or an assumption, because you're just looking at someone having an assumption that they should have a certain thin ideal, whereas they just be showing normal body diversity, and asking them if they're pregnant is also a way of showing an assumption about weight. Then there's also weight discrimination. So that's really when those attitudes and those stereotypes affect our behaviors. When we start treating differently, talking to people differently, communicating differently, that's really about our discriminating behaviors that we could have. So there's been lots of research on this. Some examples of weight discrimination in healthcare can be things like spending less time with patients just because they live in a larger body, or communicating with them in a negative, stigmatizing way. So making assumptions out loud with them. So communicating with them in a non-sensitive way, making derogatory comments about their weight, or making assumptions out loud verbally and communicating in a way that stigmatizes the person. So those are some ways that we can see what weight discrimination is. And there's lots of research to show what these impacts are. And I think Tanya's going to talk a little bit more about those impacts.
Yeah, and Angela sort of already touched on this, that the pregnancy and postpartum population is unique when we're speaking to weight stigma. Especially in pregnancy, this might be the first time that the discourse around weight is not about losing weight, but it's about gaining weight. So oftentimes when we're talking about weight bias and stigma and looking at sort of just the general adult population or amongst children, we're talking often about they need to lose weight to meet a certain thin ideal. But in pregnancy, socially, people sort of characterize pregnancy as a time of gaining weight where your body changes. And even clinically, you may be weighed more often with your healthcare provider. There's guidelines around appropriate gestational weight gain. So that's the weight gain during pregnancy. So the narrative around weight in pregnancy is actually quite different from outside of this context, where now we're talking about bodies changing and gaining weight, yet weight stigma is still persistent. There are still these social ideas of where should you be gaining weight. We did some work with pregnant individuals who have obesity, who shared that the ideal pregnant body is slim with just weight gain in the abdominal region. And if you don't meet this ideal, then you might be susceptible to experiencing weight stigma. Postpartum, the narrative now becomes rapid weight loss. You have to bounce back to what you were before pregnancy as quickly as possible, as if as soon as baby is born, you're supposed to magically just, return to how you were 40 weeks ago. And that's a pressure that individuals face, and they'll face it as a result of what's out in the media and pop culture when we look at pregnancy and celebrity culture, but also we see oftentimes these are comments that are made by family members and friends, judgments made about how much are you eating or how much are you exercising if you weren't able to bounce back as quickly as one would expect. And a lot of the work, especially some of Angela's earlier work, has shown that weight stigma during pregnancy can be experienced in nearly every social setting. So Angela shared some examples of healthcare, but we also see other prominent spaces or things like in the media where you don't see representation of larger pregnant bodies. You usually see very athletic builds or very slim women who, again, gained just in the abdominal region, and that's a very unrealistic view. And then comments made by friends and family about what you're eating at family gatherings, and just assumptions made that what you're doing is harmful to the newborn. And that's another reason why this period is unique, because what you experience during pregnancy is going to have a direct impact on fetal development as well. There's quite a bit of research out there that psychological stress or distress that pregnant individuals will face will have a direct impact on fetal development as well. So possibly experiencing weight stigma could have a multi-generation effect during this time. So that makes pregnancy and postpartum a very unique stage to both study weight stigma, experience it, and try to implement change as well.
That's really interesting. I hadn't thought of it quite in that way, but you're right. There would be like every facet of your life. I'm sure somebody would have an opinion, and we know we know how awesome that goes often for people. And as you mentioned as well, Angela, like this is a fairly new area of research as well. And it is interesting the way that you guys have presented that as well. It is really fascinating to me that this topic is so different than those other areas of weight stigma that I'm used to being in conversation about, because we are talking about that expected weight gain, not just that weight loss, and then how much is too much and all. Oh, that must be an enormous amount of pressure. But maybe Angela, Dr. ICR, maybe you can share with us a little bit more about what research has been done in this area, and kind of, because you mentioned it, now there's more. I'm sure there's still more to come, but yeah.
Yeah, sure. So, so like I said, 10 years ago, there was just very, very little research in this space. I think part of it was when I first kind of proposed this idea, I was a PhD student, and I went to my advisors and I said, this is what I want to do for my dissertation. And my whole committee said, well, women gain weight in pregnancy, so they get a free pass. There's not going to be stigma. And I was like, no, like I really think there is. And so I did some interviews and I got into hearing about lived experience. And I think that what makes this unique, which you had mentioned about, is here we're talking about weight gain, but it's not just weight gain and how that weight is gained and where that weight is gained and what that looks like. There's all these expectations, but also what your body looks like when you begin pregnancy. And so a lot of the research has shown that these areas, like, it kind of manifests either towards that your weight gain and how your body's carrying the weight, that's unacceptable, or that you were unacceptable when you became pregnant. And so there's these two sort of parallel narratives that create a lot of stigma. So over the past decade now, a lot of my work and other work, and I'm seeing some wonderful colleagues in the participant list as well who are looking at this, have been trying to document really how does this stigma manifest during pregnancy, and then how does it affect maternal and child health. And so from some of my very early work, what was surprising to the naysayers, but not really that surprising to me after talking to actual humans about it, was that weight stigma in pregnancy is everywhere. It's in media, it comes in healthcare settings, it comes from close friends, it comes from strangers. So from the person off the street who you've never seen before to your mother, your father, spans the whole gamut. And some of the thinking here is that pregnancy becomes this time when the social acceptability around discussing someone's weight really gets like dropped down. Or so I've been pregnant, and it's the only time in my life that my father-in-law has ever touched me, much less my abdomen. But he walked up and he's like rubbing my belly, and I'm like, oh my God, you're touching me, and on my stomach, and that's just my stomach, because the baby's this big right now. So suddenly it becomes okay. It becomes okay to make a comment and to say, oh, you look small, or oh, you look big, or wow, you look like you're due any day now. When normally the sort of the threshold for when you'll start commenting on someone's body is a little bit higher. And so now we're seeing evidence showing that this type of stigma is uniquely damaging to maternal, physical, and mental health. So weight stigma in pregnancy has been related to prenatal and postpartum depression, to increased risk of developing gestational diabetes, to increased weight gain over the pregnancy, and then more difficulty losing that weight postpartum, to unhealthy eating behaviors. And so this is sort of in the maternal health realm, but as Tanya mentioned, there's also a lot of reason to believe that these influences on the intrauterine environment could also translate into child health as well. So there's been now a lot of research documenting how and in what contexts and from which people weight stigma is manifesting during pregnancy, and the answer is from everyone, everywhere, all around, and then also how it gets translated into maternal and child health.
Tanya, did you have anything you wanted to add to that one? I feel like you've kind of covered in the section before, but
yeah, nothing further to add. And like Angela said, this area is growing rapidly in terms of research. So I'm sure soon we'll also see some of those associations with how it affects downstream child health as well.
It's so interesting because it's just, as a human, I recognize all of these things these moments that you guys are describing, but I never really thought about it in the context of this before. It's really important. So it definitely is a complex issue as well, like with all these different angles, but maybe let's narrow it in a little bit on healthcare. We know from talking and hearing from our community members that have shared a number of stories about their experiences with pregnancy in the healthcare system, that this is a really sticky wicket for a lot of people. So for a period of time that's supposed to be so happy for families and for people in our community, it really often has come across as more tarnished or a more negative experience because of how they've been treated by people who are really supposed to be supporting them in the healthcare system. And I appreciated how you framed that earlier as well, Angela, with that, like, you were unacceptable when you got pregnant. Oh, that hits, and that is very true. And I can guarantee there are many people living with obesity who get pregnant that feel like, okay, I squeaked that in. Now I got to be on my best behavior so I don't get too much attention through this whole process. I can relate to that on a few levels. But so how should we be looking at weight status during pregnancy, and what can health professionals do or be doing better to support their patients living with obesity during pregnancy to minimize some of these negative effects of weight bias? Because again, I'm sure they come with maybe the best of intentions behind them or the thought of a good intention behind them, but I think there are a lot there that are quite cutting. So maybe let's go there for a moment. Maybe Tanya, let's start with you and talk about that.
Yeah, and this is something that came up at the last Connected Conversations too with Dr. Ferraro and Dr. Gaudet. I mentioned earlier that weight in pregnancy is monitored more frequently in healthcare environments. So the Institute of Medicine does have gestational weight gain guidelines that are recommended, and they're based on a ton of epidemiological evidence showing gaining within these guidelines promotes optimal outcomes for both mom and newborn. And that's really what providers are looking at when they're monitoring your weight, is if you're gaining within these guidelines. And now, with that said, we want to ensure that when you're given this care for your gestational weight gain, it's still given in a sensitive and respectful manner, because it is possible to be gaining outside of these recommendations. And in fact, statistics, at least from the United States, show that 50% of women gain outside of these guidelines. And gaining outside these guidelines does not warrant disrespectful care. Rather, we need to be able to provide appropriate gestational weight management, recognizing that we need to also mitigate weight bias and stigma. So if somebody's gaining above guidelines, you don't automatically assume, oh, you must not be exercising or you must not be eating well. Pregnancy is very interesting, and on Obesity Canada's website, there's the obesity complex map that highlights all of these factors associated with weight gain. And it's interesting, in pregnancy, it's almost like we forget that those factors still exist. So it can be several reasons contributing to why you may be meeting those guidelines or not meeting those weight gain guidelines, whether above or below. And the stigmatizing perception is that you just blame the pregnant person. But what you should be doing as healthcare providers is to do a bit more person-centered work and try to understand what's going on in that person's life. Weight management is one thing, but your body's doing a million things at once when you're pregnant. Every single organ system adapts during pregnancy, and every single body reacts differently to pregnancy. Some individuals experience water retention, others don't. And there's quite a bit of physiological research explaining why these things happen, and quite a bit that we just don't know. So a role that a healthcare provider has is to be able to explain these things to their pregnant patient, to support them with weight management, but to also keep in mind that we don't want to blame the person, because they've got a lot going on. They're growing a human, and that's a lot of pressure on its own.
It's so true. And even just the fluid volume that changes in a pregnant body is just like, where does that go? Bodies are fascinating to me. So this is all amazing. But let's focus in on those healthcare providers a little bit, maybe. And Angela, maybe you have some thoughts on that from your research and work that you've done.
Sure. Yeah, I just want to echo what Tanya was saying about healthcare providers. Like, I think what's really important to recognize too is that we all have biases, and we do have to recognize that most of us do, whether you're a healthcare provider or not. We all have these kinds of intrinsic, automatic type reflections about people. It's just something that we can't really negate that we don't have. And we like to think that people come into this well intended. And it used to be thought that, well, if you blame and shame a person enough, then they'll change their health behaviors. But anyone who's a psychologist here on the call, or anyone who has any background in psychology, will say decades of research in psychology has shown that blaming and shaming anyone doesn't change health behaviors. So I think that's important to just reflect on and recognize. And just the fact that we all have biases. What's important to know is that we have biases and we need to reflect on them before we start making assumptions. And I like what Tanya was saying before about asking more questions, approaching things with more curiosity. As soon as we realize, okay, we're having an automatic reflection or attitude about something, to just dig a little bit deeper, ask more questions with pure curiosity, just to understand more what the patient is sharing in front of you before making assumptions and before providing prescriptions also. Well, you should exercise more and you should eat a more well-balanced diet and things like that. So I think it's important to reflect on those assumptions, understand them before you start changing your behaviors or before you start making suggestions to patients, before that really can get hurtful. Because what ends up happening, I think what's important to recognize too, is that if you're a person who's living in a larger body, you're already going into the healthcare system, you've probably already had experiences of perhaps weight stigma or negative stereotypes about your weight, even before you become pregnant, if you're already living with a large body. And then you become pregnant, you have the additional stereotypical assumptions and expectations of what a pregnant person should be, the habits, what you should look like, and what Tanya was sharing about the media and all these other messages that we're getting everywhere with our family. Angela, I also want to echo, I've also been touched like that too by family and friends and even strangers during pregnancy. And it was just like so shocking that these kinds of things happen during pregnancy, where it's like, okay, that these things happen. But, I guess it's just important to recognize that this is coming from everywhere. And as a healthcare provider, if we're not challenging these assumptions and we're not providing sensitive care, it really may divert the conversation and may cause participants and patients to avoid the healthcare system, avoid the antenatal, prenatal care visits and follow-ups and screening tests and things like that, purely because of that anticipated stigma that might happen in the healthcare system. So I think we just have to be cautious of that, be aware of our assumptions so it doesn't change our behaviors, and just recognize that we're all doing the best that we can. And we have to give the benefit of the doubt to patients and participants too, that they're also living in this world, having compounded type stigma, already living in a larger body, and showing that our built environment is not necessarily supporting these people living with larger bodies, and then also having pregnancy and those expectations too.
That is very powerful. It's so true that all of that expectations of you're just going to look like you glow and you're going to float on a lily pad and this is going to be beautiful. And it often is not, whether you're in a larger body or not. And also that almost dehumanizing of your body, and that it is now communal. Everybody is welcome here, touch away, all those kinds of things. It's what a complex time. But I love where we're going there as well about how pregnancy is portrayed in the media and even how we interact with friends and family, and how much all of that noise can really play a part in the experience that we have. And as you said, possibly even generational care after that. So maybe let's talk a little bit about how that weight bias influences these areas and any suggestions we might have for how individuals can push back against those kinds of moments or conversations that they might be in. I'll go to my friendly American because I think that's probably a good place to go for some healthy boundaries as well. But how can we kind of how can we help empower people that are in this space? Because I also really love, sorry, before I go to you, the way that you guys were talking about being curious as a healthcare provider. I know the most supportive I've ever felt have been when I'm maybe not having my best moment, but I have a healthcare provider that's like, let's figure this out. Let's just talk about this. Let's not even worry about what's supposed to be happening. Let's just help me get in the same room as you. And then we can then talk about what solutions look like. So I want to just amplify that because I think that's a really small but important step that a lot of people can do. But let's arm our friends that are going through these moments with some ideas that they might have on how they can navigate these conversations.
Yeah, so it's you mentioned media and you mentioned friends and family, and they're kind of two obviously there's related facets to them, but from my research, the media are actually one of the top sources of weight stigma that get endorsed when I'm asking people, where are you experiencing weight stigma during pregnancy? And it's really, I think, the media that is, if not creating, then definitely propagating and reinforcing these expectations. The idea of that ideal pregnant body, oh, I can't even tell if she's pregnant from behind, or the snapback culture where we glorify women who don't look, how dare you look like you have a baby or had a baby right after you had a baby? No, you have to look like it never happened right away. And we glorify that, even though it's not even normal. It's normal to look like a child was in you when the child was in you for 9 months. And some of this, from my research, I found comes a lot from how we glorify celebrities. And so, obviously celebrities live very, inaccessible lifestyles in every single way. And yet, because this celebrity, looks this way right after she had a baby, then that's how we all should be, trying to sort of build our goals. And then sort of on the flip side of it, while the media spends so much time glorifying, whether it's the media or social media, glorifying, the snapping back, or, gaining very little, or, the cute little bump and all that stuff. While all that happens, there's not really representation of larger bodies during pregnancy in the media. And so people don't know what the diversity of pregnant bodies can look like. We only think of pregnancy as one way, whereas a body can carry and accommodate a fetus in many different ways, and the weight can be distributed in many different areas. And we think about weight, but you're mentioning, there's fluid, there's tissue, there's placenta, there's baby. But so there's a lot of different things that could get placed different parts in the body, but the media isn't representing pregnancy in a way that's very realistic, or that shows the many different forms that a pregnant body can take. If we think about television shows, pregnancy prostheses only look one way, it's just the same thing every single time. And so that means that we have, sort of glorifying something that's unrealistic, not showing something that is realistic, and then placing a lot of blame on people for not meeting sort of these unrealistic standards. In terms of friends and family, this is something that Tanya and I are looking at a lot now, because it's another one of those sources that's very commonly endorsed, and there's been a lot of attention in the research on healthcare and on the media. But family and friends, they're these people who hopefully are there to support you throughout your pregnancy. Pregnancy is difficult, and obviously having a tiny human that needs you to survive is difficult. And so we oftentimes rely on family members and friends as these critical forms of social support. And social support is so important for our health. And yet, if our critical pillars of social support are actually the people delivering weight stigma to us, then it's this double whammy. Now, we don't have the social support that we would rely on, and we're getting stigmatized from these really close sources. And so this is where the media comes back in again, because my research has found that a lot of times it's family members who are comparing women to the ideals and to the standards that they're not matching. And so those expectations that are created and propagated and spread through and reinforced through the media are now being communicated from a family member or from a friend back to the mother. So you asked me, like, what do we do? How do we armor up against this? How do we, I guess I have to be like the unfriendly American here to say, like, the really strong stance we have to take, because really what we need is a culture shift. So of course, like, physicians might need to talk about weight, though hopefully in a way that isn't stigmatizing, because weight stigma ironically promotes excess gestational weight gain. But physicians might have to talk about weight. Really, no one else does. And so I think we need to shift the narrative where, instead of lowering the threshold for when it's acceptable, like, make it completely unacceptable. Like, during pregnancy, weight just can't be on the table. And so part of that, of course, is, calling out, the negative comments. But I think that those are almost in some ways like the less insidious ones, because I think it's glorifying the unrealistic image that is really creating this culture. And so, like, if someone, if someone gives you a compliment, like, wow, you're so tiny, you should say, oh, well, actually, I'm just trying to, like, keep some weight on, because I'm sick or whatever. But making it so that way it's not a compliment to tell somebody that they look so small during pregnancy, or wow, you snapped right back. I'm not gonna lie. In my most recent like postpartum period, I took on this like really obnoxious stance of like wanting to shut down anything that somebody would think was a compliment. So if anybody was like, "Wow, you bounced back so quickly," I'm like, "I'm not going backwards. I'm just focused on moving forwards. I'm trying to take care of 3 kids." So why are we talking about bouncing back? Like,
Beautiful.
I recently I heard somebody describe pregnancy kind of like puberty. Like it's one of these things that it changes your body. You'll never go back again. It's not all bad changes. In fact, there's lots of really positive changes that come out of pregnancy. And but so why are we talking about bouncing back? Like there is no going back to before you had a child. There's only moving forward with the body that you have. And so of course, like yes, be nice. But I think that really the strongest stance we can take is like shutting down the dialogue altogether and not making it seem like talking about somebody's weight or weight gain or weight loss in any way, even if you think it's kind. And if you're with a friend and someone you have some goodwill with, and they say like, "Oh wow, like you look so tiny," you could say like, actually, it makes me pretty uncomfortable. Like, maybe we could just like not make those comments going forward, because I think it's the positive comments that are so insidious because they create this cycle that we should be glorifying people for having these kind of unrealistic weight trajectories.
Oh, I love that.
I
That's
got
so true.
I got
Go
something
ahead.
I wanted to jump in here with when we're talking about media, and maybe it's not even just the weight specific comments or the comments about the body, but there's one that I was having a conversation with someone in our community who was telling me about an experience they had, and it got me thinking about a movie. And there's this very vivid scene from this movie. It's a Jennifer Lopez rom-com movie where she gets pregnant, and there's a scene where she's going on this date with this guy or whatever. He makes her dinner or whatever, and she's in his house, in his kitchen. He leaves the room, and then she's ravenous for the food. It's like chili or something, a pot of chili, and she grabs 2 buns and she's like loading her face with food with this, and it's because she's pregnant and all this stuff. And I got to thinking after this conversation with the member of our community, like, because it was Jennifer Lopez and someone who looks like her, we laugh and we joke and, oh, it's hilarious. She's a pregnant woman who's got crazy cravings, and that's okay. And that's what it is. But if it was someone else, someone with a different body, they would be looked at completely different because of that. And they would be looked at as possibly harming their child or doing something wrong. And it's just a completely different view on things. And as you were talking about media and stuff there, it got me thinking, it's not always just about the weight and making comments about bodies. It's about everything we talk about that's related to it.
Mm-hmm. And that level of intelligence that's assumed as well. Ugh, can we not?
Yeah, that made me think about like when I was talking with my committee and they were saying like, "Oh, but you have to gain weight during pregnancy so you get a free pass." And it's like, well, maybe people in smaller bodies get a free pass, but when we're talking about, like that same grace isn't extended. And so what you brought up is like it's probably equally damaging to perpetuate these stereotypes, about like, oh, like, pregnant, like the cravings and everything like that. It's like, well, when you portray them in this like silly way, it kind of detracts from what pregnancy is really like. And then this, like, people in larger bodies don't get that same grace. So when that same behavior is shown, now it's unacceptable.
Mm-hmm. It just depends on who's doing it. That's really fascinating. Let's talk a little bit more about that postpartum. I'm in love with what you said there as well about like, I'm not going back, I'm only going forward, because I think that's huge. I wish one of the things that I wish is that all of us would understand that bodies change, and they should. For all of us, that's what it should look like. But let's talk about postpartum, because as much as weight gain is a focus during pregnancy, as we've been talking about here, postpartum, that focus quickly goes back to weight loss and how quickly can we lose weight, how important it is to get back to that pre-pregnancy weight, and perhaps most importantly, like, what is the impact that discourse has on that, really pushing that narrative that it's like, how quickly are you going to get back, and getting back to something that might have taken you a lot of effort to get to in the first place. That's so compounding. And like, is that really the focus when I have a brand new human that I'm also meant to be kind of sustaining and learning about as well? So maybe Tanya, let's go there for a second and talk about that compounding element.
Yeah, and this is actually a really complicated question, Lisa, if you look at it from both a social and a medical standpoint. There's, again, a lot of the weight research and evidence when it comes to impact on um, health outcomes, physical health outcomes for mom and baby are based on epidemiological evidence. And there's quite a bit, again, showing that postpartum weight retention, so that's the weight you have that you hold on to after you've had your baby, is associated with things like later life weight gain or increased risk of gestational diabetes in your next pregnancy. And so those recommendations to reduce your weight back to what it was before you got pregnant often come from that epidemiological evidence to try to reduce risk, especially if you're going to have another baby. But at the same time, that does not take into account the social stigma, a lot of which that Angela brought up, that comes from celebrity culture, where we celebrate those individuals who could bounce back as quickly as possible. It doesn't speak to healthy ways to manage your weight after having a baby. So we don't have much research on, well, how long should it take you to return to your pre-pregnancy weight? There's quite a bit of questioning on, if you were to rapidly lose weight, irrespective of pregnancy, you might be doing more harm to your body, right? If we don't want you to be going on crash diets or excessive exercising, fad diets, etc., similar to outside of the pregnancy context. So I think a lot more work needs to be done on this pressure to lose weight quickly postpartum, but also work on how do we best support our postpartum mothers in, like you said, Lisa, managing all the work that comes with being a new mom and also your bodies. And you also have to take into account there's other things going on. You may be breastfeeding. If you had a C-section, your recovery is going to be very different from someone who didn't have a C-section. You may have physical traumas that you need to heal from prior to returning to your day-to-day. So there's a lot going on physically with the body, that the added pressure of trying to bounce back, it's just unnecessary, for lack of better words. It's just not needed in this time frame, and we just know very little on what is an appropriate amount of time to lose weight, how much weight to lose. We're really just relying on numbers when we talk about that.
And again, we know all of us are individual, and our individual bodies are going to react differently. And
Yeah.
Quite honestly, you also just went through an experience where now you are a new version of you. You need to figure out you as well. And we need to give people that space.
Yeah. And I was also thinking about, as Angela was speaking, why is it a compliment to tell a female that, you don't look like you've had a baby? What your body did is pretty impressive.
Yeah.
So why is that a compliment that you look like you didn't do it?
You just managed to put that away.
Yeah. Or during pregnancy, why is it a compliment to not look pregnant? Like it just doesn't make sense when you look at it that way. So it really speaks to the fact that thin idolizations are just persistent all the way across life course.
Absolutely. And so let's go there and talk a little bit about mother blaming as well, because we know that can really occur for women. I think it happens for all women, but women who also live in larger bodies or live with obesity, they can really carry around a lot of guilt, because they're getting this messaging that they're potentially harming their children just by being who they are, how their bodies were formed before they even got here themselves. And like, where does that stem from? How that can impact the mother? Like, that's got to be really big. So Dr. A, I look to you, my friend. What has been your insights, or what can you how can we talk about that one a little bit and help people get away from that mother blaming, or how to relieve themselves from it?
Oh my gosh, I feel like this is a life course question too.
I was going to say, and now we need another hour.
Yeah, exactly. Yeah, because then when we think about mom blaming, anyone here who's a parent, a mother, however you identify as having a child, mom guilt is a very real thing. I have 2 young children, and I very real to have mom guilt for lots of different things. But now when we think about this like mother shaming, this is in research, we call this weight bias internalization, where we start internalizing and we start believing that the stigma that we're getting is actually deserved. So we deserve to be stigmatized. We deserve these negative attitudes about our weight because these are socially acceptable and I'm not fitting into that socially acceptable mold. So that blaming and shaming and that mother blaming for, you know, putting on too much weight, causing an increased risk for their child, predisposing them to increased risk of childhood obesity, for their own weight gain, for their own health. That kind of blaming and shaming is really problematic, and it's really harmful to people's health, not only their mental health, but also their physical health. So there's actually been a lot of research that has looked at associations between internalizing this weight stigma and mental health and physical health. And what these studies have shown is that the more people tend to internalize the stigma, the more they tend to endorse and believe that they deserve to be stigmatized for their weight, the more they tend to have depressive symptoms, the more they have anxiety, the more they have other depressive episodes and information that really makes them feel badly about themselves. And it affects even their health behavior. So there's actually research that also shows the more you internalize the stigma, the more you believe this to be true about yourself, that you deserve to be stigmatized, it may also affect your healthy habits. So it may cause binge eating, it may avoidance of physical activity, or actually the opposite of overexercise. So there's been research to suggest that this is also harmful to people themselves experiencing the stigma. I think what's really important to understand is that when people experience a form of stigma, they experience a form of stress. And that stress affects their mental, physical health, their state, and their health behaviors. And the challenge with this is that I think sometimes this is often misunderstood and not really like taken under consideration, because, you know, a person's accessing the healthcare system or they're speaking with their friends and family about whatever's going on in their life, they may already be self-stigmatizing themselves and blaming themselves, carrying guilt and shame about their own body weight, feeling that they did this to themselves, feeling that they're already increasing the risks of their child or their, you know, future baby, that they already carry that stress. Then imagine also being compounded to that by other stigma from other people. It's really harmful. That like double stigma and shame that you're getting from yourself, that you're putting already from yourself, because, you know, we're not oblivious to all these thin ideal messages that are literally everywhere. So Lisa, when you asked also about like, what are the causes for this mother shaming? And I think Tanya and Angela have already answered this quite a bit in other conversations, is about, you know, the media, social media that's out there. It's also fat talk too, which is like this concept of talking about fatness or talking about gaining weight, especially with the holidays coming up. This fat talk comes up a lot. You know, people come back from the holidays and they say, oh, I had so many cookies and cake, like I'm so fat now and I really got to lose this 10 pounds. Like that kind of fat talk, or fat talk that you hear in the changing rooms at any clothing store. You'll hear like, do I look fat in this dress? How does this make me look? You know, like that kind of fat talk is also a big contributor to this type of mother shaming. So is social media. And these like, you know, I think Tanya alluded to this too, like gestational weight gain recommendations. As much as there has been a lot of epidemiological research to suggest that there is a link between excess gestational weight gain and health outcomes, there's also that predisposition to thinking about that all the time, the focus on weight and that, you know, on the focus on the controllability of weight too, even during pregnancy and postpartum, is also problematic and also increases that mother shaming that's all blamed on the mom, you know? So it's complicated and it's so hard because we're so hard on ourselves. So I think it's just important to recognize that it's challenging and it really does exist out there.
Oh, that's huge. I've said that before as well, that, you know, I've part of the challenge of living with obesity for myself, and I feel like I've seen it in others, is there's this wedge that diet culture puts between you and your own self, and being able to trust and have confidence in your own body autonomy and understanding and expressing what is actually happening for you. We make really big chasm there. So then compound on top of that, this pregnancy moment and your body going through all these things that have never experienced before. I can imagine it must be a really desperate feeling as well, to want to be so successful and feeling like you were behind just before you even left. So we've talked a lot about that impact of weight stigma on the mom, but I know you guys have also alluded to, pardon me, like this can have impacts on the child as well that has come forward in this moment. So maybe let's just spend a couple minutes on that and talk about how that weight stigma impacts that next generation. Angela. Incollingo.
Sure. So, sorry, I have such a ridiculously long last name. But every time you say Angela, I'm like, okay, I think she means this Angela. So I guess the real answer is maybe we need to have another conversation in like 3 years, because this is something I'm working on really hard right now. But I think from the research that has come out, like that weight stigma promotes postpartum depression, and we know postpartum depression has direct effects on infant health. Weight stigma also seems to undermine breastfeeding efforts. Postpartum depression also makes breastfeeding harder, and we know about the importance of breastfeeding for child health and development. So those are sort of insights I can glean from the research that we have there. But if we think more broadly, we know that, like my co-Angela said, that weight stigma is a stressor, and stress changes our stress physiology. And so now the intrauterine environment has different stress hormones in it, or different levels of stress hormones, different profiles, and that changes and it primes the child's physiology for the child's entire life. So we know that intrauterine environment is pivotal in shaping lifelong health, shaping physiology, even promoting obesity. And so if we can conceptualize now that weight stigma in pregnancy is this stressor, stress affects maternal health. It also affects sort of what we experience even before we're born. Then I think that's really where we see the link for how weight stigma that the mother experiences can translate into predisposing the child toward different health profiles throughout their entire life. And in that vein, one thing, somebody once told me, like, do you really want to commit your career to this like very niche area? Like, how many people would really be affected by this? And I was like, well, to my knowledge, every human being was born. And so what happened to that person's mother affects them. And so really this kind of affects everybody. So in that vein, like I think that really through like the way that we know that maternal and child health are just so inextricably linked, that's where we can, really start hypothesizing about how maternal weight stigmatization translates into child health.
And we've said it here as well, like that internalized bias gets so baked in, and that is also what we get taught along the way. So it's important. This is a really important conversation. And as such, we have only 3 minutes left. I just looked at the clock as well. So I think let's bring this all together. And what I would love to do just to get there, I think, Ian, if there are questions, maybe we'll move those to the connected environment, or we'll have a follow-up conversation. But to wrap this up, I'd love to give each of you an opportunity to share with us what's something you really want to have as a key takeaway for anybody who bumps into this session and gets to hear these words, so that they feel really empowered and feel like more knowledgeable around weight stigma during pregnancy as a whole. So why don't we go in the same order that we started with? And Tanya, I'll get you to go first.
Such a big question.
It is just a little one to bring us home.
I think if I had to pick one message, I think to the individuals who've gone through pregnancy, just your bodies are amazing, and what your body did is incredible. And I think weight should not be a factor that determines whether someone should or should not get to experience pregnancy. It should also not be the factor that decides how you'll be treated during pregnancy, and it should not be the factor that's focused on when you're a mom. I think like to be able to go through pregnancy and postpartum is so impressive. Your body's doing a million things at once, and that's enough.
I love it. Awesome. Whichever Angela would like to go next, feel free.
I'll let my US teammate go first.
Cool.
Okay. Oh well, you unmuted yourself. I'm like, okay, I can think for a moment, but it's okay. I have a thought. Well, I already mentioned, I think, about that each one of us can really, even with our best intentions, maybe stop glorifying the ideals and the expectations, because that creates the narrative as well, and maybe just low, like really raise the threshold for when and under what circumstances you'll comment on a woman's weight in any direction during her pregnancy or after her pregnancy. And then in the healthcare arena, to healthcare providers, I just always want to remind them that stigma is not only unkind and unconscionable and poor quality care, but it's this really missed opportunity, because women enter pregnancy, this uniquely engaged audience, ready and willing to make real modifications. Like, it's a time when smoking cessation is successful. And so it's really like a missed opportunity to capitalize on that, to not take pregnancy and have it be a time where you focus on intuitive eating and healthy lifestyle modification and optimizing nutrition and things that will have benefits for the mother's entire life and the child's life. So not only does stigma have no place in healthcare, but it's also really standing as a barrier to this opportunity for health promotion that you typically don't get.
Okay, I'll go last quickly as I'm seeing time runs up. I just want to share it by concluding and saying that I think we need to be kind to ourselves, because we all make quick assumptions. We all have biases. So I think the first thing is to just recognize that, let's be self-compassionate. Let's recognize that we all have biases. Let's address those assumptions by approaching things with curiosity and try to understand things better. And also be an advocate and express when you think something is unfair and you're being treated unfair. Whether that's just vocalizing your opinion by just saying, I feel that something you said was hurtful, or I don't feel comfortable discussing this. I think those are really important, and taking those opportunities to address change and making an effort to try to reduce weight bias and stigma in all these different settings. Even just by being an advocate with one person or in that one interaction can help make these changes over the long term.
It's huge. And I truly believe in that as well. I believe that we all have within our own, wherever we are, whatever little power we might have, we can make a difference in the world in these moments. And I love that. Even just having the courage just to say, I'm not really interested in talking about that part. That could be enough to just make it stop. You can also do things that I do and turn around magazine covers in grocery stores. Join us in our mini revolution along the way, everybody. But I want to thank you three so much for the work that you're doing, all that you bring into the world, and continue to have these conversations and help us fight this good fight. Really appreciate all your time and your talent. This recording will be live. Please share it as well with people who you know in this who might be going through this moment in their life. And feel free to join us over in OC Connect. That is our patient community where we like to share resources. We'll continue these conversations. We have some questions that we might follow up in there as well. So please continue to follow along, join us, help us make this change. We have an upcoming conference on March 4th, which is World Obesity Day, which will be a connected conference. You'll see more about that in the community and out on your social channels as well. We really hope you can join us that day, and let's continue. This has been a really big moment of change in the world of obesity, and I think that we can really starting to make some noise and really make some impact really soon. So I'm excited for that. Please continue to be kind to yourselves, be kind to at least one other person today. Keep washing your hands, take good care of everybody. And thank you again, ladies, for joining today. We hope to continue the conversations over in Connect. Take good care, everybody.